Hello, I'm Richard Fairburn. I run HSC Professional, offering consultancy services to providers and managers of care homes and home care agencies. And in this video, I'm looking at notification of other incidents, requirement to notify incidents other than deaths and changes of management. If we look at the CQC website, we will see that you only need to notify us if coronavirus affects the day-to-day running of your business. That doesn't narrow it down an awful lot. And indeed, I would respectfully suggest that if the existence of the pandemic did not affect the day-to-day running of your business, you would probably be in breach of more regulations than I'd have time for right now. If we look at the guidance, bottom right there, click on that, dated April 2015, we see that it covers events that stop or may stop the registered person from running the service safely and properly. So what does that mean? Well, let's have a look at the regulation and find out. The regulation concerned is the Care Quality Commission Registration Regulations of 2009. And if we go to Regulation 18, we see that there is a requirement for the registered person to notify the Commission without delay of any of the incidents specified in the list that we see there. And the one I'm going to look at is under item G, any event which prevents or appears to the service provider to be likely to threaten to prevent the service provider's ability to continue to carry on the regulated activity safely or in accordance with the registration requirements. And I'm not going to look at premises or utilities or fire alarms, but it includes an insufficient number of suitably qualified, skilled and experienced persons being employed for the purposes of carrying on the regulated activity. Now, one or two comments are worth making. Where it says without delay, if you take that as meaning within one working day, you won't go far wrong. Where it says appears to the service provider, include where it jolly well ought to appear to the service provider. Where it says employed, that is not a payroll characteristic, it's the person's being deployed, in other words, the staff available. When it comes to in accordance with the registration requirements, that's where it gets a bit more complicated. But this is the key to understanding this notification. So here we go. If we look at the Health and Social Care Act, we find that there are set down the grounds for registration and the grounds for cancellation of registration. So section 12 says if the Commission is satisfied that the requirements of regulations under section 20, regulations under the Act, and the requirements of any other enactment which appears to the Commission to be relevant, if they're being complied with and will continue to be complied with, then they will grant registration. Now, the other side of that coin is the grounds for cancellation of registration in a later section. I haven't included them all, but one of them is that the regulated activity is being or has at any time been carried on otherwise than in accordance with the relevant requirements. And in this section, but not in the earlier one, we find a definition of the relevant requirements. Any requirements or conditions imposed under the Health and Social Care Act, and the requirements of any other enactment which appears to the Commission to be relevant. So, as you might expect, the requirements, breach of which would cost you your registration, must be the same, and they are the same as the requirements compliance with which permit and sustain registration. And the obvious relevant requirement for our purposes here is Regulation 12, Safe Care and Treatment. Care and treatment must be provided in a safe way for service users. The registered person must assess health and safety risks and do all that is reasonably practicable to mitigate any such risks. Now, where there's a breach of that regulation, it comes under the heading of the offences list. So we see that failure to comply with Regulation 12, among others, is an offence if such failure results in avoidable harm or exposure to a significant risk of such harm occurring. The stuff of inspections. But look at the last paragraph in that regulation. It is a defense for a registered person to prove that they took all reasonable steps and exercised all due diligence to prevent the breach. Now, obviously, this is intended to be the standard expected in the criterion to be applied in the magistrate's court. But it is also the test of compliance with the regulation in your daily practice. Now, the regulation doesn't say that, so how come I can? Well, there are two reasons I can say that. First of all, the standard to be tested in the magistrate's court could only be the same standard that is applied in your daily practice. And the second reason is that it is not the state of our law that whatever you do, you would be in breach of the regulation. So if we come back to the notification requirements, where you are taking all reasonable steps and exercising all due diligence in the face of the onslaught of this pandemic, with or without cases of COVID, with or without deaths in your service, if you are taking all reasonable steps and all due diligence, you will not be at risk of breaching Regulation 12, and therefore the notification would not arise. And if I know care providers, and I should do after 20 years in the industry, including 15 representing providers locally and nationally, and after 20 years of consultancy, I can say with pretty great certainty that most are in that position, that notification will not arise. Now, there could be outside events that put you in breach of a regulation. Your next delivery of PPE didn't arrive. Your staff numbers suddenly dropped over a period of a couple of days, or perhaps hypothetically, that somebody with COVID-19 continued working despite knowing that they were developing the symptoms of the disease. Those sort of events could put you in breach of the regulation and trigger the need for the notification. Now, it's worth a footnote that failure to comply with the notification regulation is a breach of the relevant requirements and could result in a warning notice. And it's also worth noting that the registration regulations themselves do not provide for a reasonable excuse. So while there is a reasonable excuse in compliance with the regulation, in terms of the notification itself, no reasonable excuse arises for a breach of the regulation. Hence, the triggering of ratings of requires improvement where there is a breach of regulations, and that includes the notification regulations not infrequently. Now, as you probably know, CQC has recently stopped doing their routine inspections, and they announced that on their website. Quite unnecessary, because if an inspecting officer left her house to tramp around care homes risking spread of COVID-19, she would be liable to arrest and prosecution. Nevertheless, we've got that recognised by the CQC, and they have put in its place what they call an emergency support framework, which they say are not inspections, and which I say are inspections under another name. And the evidence for that is in the words of the website itself. Although we paused our routine inspections, our regulatory role and core purpose of keeping people safe has not changed. We've therefore developed an emergency support framework to follow. And if you look at the questions, they are set out in a number of areas. Area 1, safe care and treatment. Area 2, staffing arrangement. Area 3, protection from abuse. Area 4, the ongoing requirement for assurance processes, monitoring and risk management. And these are the questions that will be asked in the 1-hour call of the emergency support framework. So be ready for that. And that's it for this video. As I would always say, please stay as safe as you can.